Welcome to the First Principles of Medicine podcast. In this series, we will be breaking down complex medical topics into their first principles. When the stress is on and you've just been asked a tough question that you don't know the answer to, we feel you'll be able to fall back on these principles to formulate a decent answer and perhaps reason your way out of trouble.
This is the summary version of the CKD 1pm episode. So CKD is defined as a GFR less than 60 mils per minute for greater than 3 months with or without evidence of kidney damage, or evidence of kidney damage such as albuminuria or hematuria for greater than 3 months with or without a reduction in GFR. And CKD can be broken down into various stages from 1 to 5. And the most common cause of CKD is diabetes mellitus. In order to understand the complications of CKD, it's easier to understand the 3 basic kidney functions and relate it to that. So the 3 basic kidney functions are to regulate concentration, excrete metabolic waste products, and to synthesize hormones. And under regulation of concentration, we have regulating the sodium-water balance, acid bases, and electrolytes, particularly potassium. And under excreting metabolic waste products, we've got things like urea and drugs. And last but not least, under hormone synthesis, we've got renin, which control blood pressure, erythropoietin or EPO, which control red blood cells, and calcitriol, which is important for bone health. So in regards to complications of CKD, under regulation of concentration, there are 2 main complications. These are hypertension and hyperkalemia. Under excretion of metabolic waste products, we've got a complication of metabolic acidosis. Under hormone synthesis, we've got 2 complications of normocytic anemia and hyperparathyroidism. Under multifactorial complications, we've got increased cardiovascular disease risk. And last but not least, we've got kidney-specific complication of increased acute kidney injury or AKI risk. So in regards to management of CKD, this can be broken down into non-medical and medical management. Non-medical management consists of lifestyle advice or patient education, and there are 5 things to educate a patient about. These include dietary advice, which involves reducing sodium, reducing calories, and having a low-fat diet. Other important lifestyle advices include weight loss, smoking cessation, increased physical activity, and reduce alcohol intake. In regards to medical management, this can be broken down into 3 important categories: slowing CKD progression, reducing cardiovascular disease risk factors, and monitoring for CKD complications. In regards to slowing CKD progression, we've got 4 important things to control. We've got blood pressure control, glycemic control, reducing proteinuria, and using SGLT2 inhibitors, as they've been shown to be nephroprotective. Under reducing cardiovascular risk factors, we've also got BP control and glycemic control, which overlap with CKD, as well as lipid control through the use of statins. Under monitoring for CKD complications, we want to monitor for declining renal function using tests such as UECs and urine ACR, as well as measuring their blood pressure. We also want to check for anemia by doing a full blood picture, iron studies, as well as looking at their folate and B12 levels to exclude non-renal explanations of anemia. Under bone disease, we want to look at their calcium levels, phosphate levels, as well as parathyroid hormone levels. Last but not least, we want to look for any electrolyte disturbances by using a UEC and looking at serum potassium as well as bicarbonate levels. So altogether, that wraps up CKD. Thank you all for listening.
Thank you so much for listening to our episode this week. To get the most out of this podcast, check out our Anki flashcards and our Notion document. For all your first principles, keep it right here at 1 p.m.